Today I'll be presenting an informative speech on urinary tract infections, also called UTIs. According to the Department of Health and Human Services, urinary tract infections are the second most common infection in the body, accounting for about 8.1 million visits to a healthcare provider each year. Anyone at any age can be affected by a UTI. This is why all of you will benefit from this information I'm giving you. An untreated UTI can also be life-threatening. And also, UTIs can be easily prevented. This is also information you guys should know. You might be wondering, what's a UTI? A urinary tract infection, or a UTI, is an infection that can happen anywhere along your urinary tract. UTIs can have different names depending on where the infection is located on the urinary tract. If the infection is located in the bladder, it's called cystitis. If it's located in the kidneys, it's called pyelonephritis. And if it's located in the urethra, it's called urethritis. As you can see here, there's one main cause for a urinary tract infection. UTIs are usually caused by germs that enter your body through the urethra and then make their way to the bladder. And here there's also listed the risk factors for a UTI. They include diabetes, older age, and people who are of older age that come to the hospital will present with confusion when they have a UTI. Urinary retention, which is when you are unable to urinate. Urinary catheters, when you do have a Foley catheter inserted in you, your infection rate will skyrocket if you don't take it out right away. Bowel incontinence, when you're unable to go to the bathroom. Enlarged prostate, kidney stones, immobility, and pregnancy. Also, when you have any type of surgery involving your urinary tract, your risk of infection also goes up. Women are also more at risk than men due to their shorter urethras. And here in this picture here, you can see the male and female urethras, and you can tell how much shorter the female urethra is than the male. Signs and symptoms. As you can see here, there's a few signs and symptoms of urinary tract infections, and most people will present with these same exact signs and symptoms. One of the main signs and symptoms of a urinary tract infection is a strong, persistent urge to urinate. This is when you feel like you have to go to the bathroom all day, and when you do go, you only go a little bit. This goes along with passing frequent small amounts of urine. You may also have pain or burning with your urination. Your urine may be cloudy. It also might be red, bright pink, or cola colored, which indicates you have blood in your urine. Your urine can also have a strong, foul smell, and the women may present with pelvic pain, while the men will present with rectal pain. Your doctor will diagnose you for a UTI with three main tests here. The first one is called a urinalysis. This is where the doctor wants to test what's in your urine. If you have a high white blood cell count, this means you have an infection, and this can mean any type of infection, not just a UTI. They may also do a clean catch urine to identify what type of bacteria exactly is growing in your bladder, and then they can decide what type of antibiotic to use from there. And lastly, they'll do a CBC and a blood culture to see how the rest of your body is affected by this infection. The treatment options, really, there's only one main treatment for a UTI. This is antibiotic treatment. And you can either be prescribed them orally or through an IV. The duration can last anywhere from 3 to 14 days depending on how severe your infection is. Your doctor may also prescribe you pyridium, which alleviates the pain with urination. This also can cause your urine to be orange, so keep an eye out for that as well. And lastly, drink plenty of fluids. It's very important to stay hydrated. There's also many complications involving a UTI when they aren't treated. You may have a life-threatening blood infection called sepsis. This goes along with any type of infection, so make sure you get treated right away. You can have permanent kidney damage or scarring along with kidney infection. This is when you don't treat the urinary tract infection and it does travel up to your kidneys. This is also very important, and you could be hospitalized. Recurrent infections, especially in women, will keep happening after they have 3 or more UTIs. Also, women who are pregnant that do have a UTI during their pregnancy may even have a low birth weight infant or premature infant. Prevention is key in this case. You want to drink plenty of fluids, especially water, like I've been stating earlier. You can also drink cranberry juice as well, but you want to stay away from the cranberry juice cocktail. It has way too much sugar. You want to stick with the regular cranberry juice. You can also avoid taking baths, especially if you have a history of UTIs. Definitely stay away from taking baths. You always want to wipe front to back no matter what. Also, you want to empty your bladder soon after intercourse. This goes for males and females. You also want to avoid potentially irritating feminine products. This obviously goes for the females in the audience here. And you want to avoid tight-fitting pants and wear cotton cloth underwear. This gears more towards the males of the audience. And in conclusion, UTIs can be easily prevented. If you drink plenty of water and empty your bladder as much as possible, this can really prevent a UTI. I hope this presentation has provided you all with plenty of information about your health. And I hope you keep in mind that UTIs can affect any of you, and I hope you really take this information seriously, and I wanted to thank you. Here are my resources for my project, right here. And then I wanted to show you my audience. And here's my audience, my two sisters. All right, thank you.